This
We want,
conference will now be recorded.
now we're recording. You missed all of the stuff about reducing transmission risks, but I'll make sure to get the notes to Lori to include. Um, Now we're getting to a part where we understand more about what the risks of this virus are to us, and we're even talking about opening up buildings and offices and marketplaces. And what we're seeing is we want guidance. We want guidance on how to wear personal protective equipment. We want guidance on how to ensure our workplaces are safe. We want guidance about what's expected of us when we go out for a walk. And so those press conferences by Bonnie Henry are really important to us to let us know, should we be wearing masks or should we not? So these are expectations we have. Other expectations that we have that are maybe not as clear would be research. We want clinical research for treatment. We want to see policy made around how that clinical research can be done when we want things to move quickly. What kind of ethics protocols do we want to maybe scale back, and which ones aren't safe to do so that we can speed up how this research happens. We want to see treatment rolling out quickly, and we want to see other research that's maybe not clinical but tells us about what our risks are. We want you to look at the data and tell us, why is it older folks that are having a higher mortality, and what is our risk within our home? What's the likelihood of somebody in your home getting infected by another positive individual in the home? Because it tells us how we can combat in transmission in our own lives. And so we want people to say, oh, well, we're seeing, maybe this gender versus this gender being at higher risk, or we're seeing these age ranges, with the 1918 pandemic, it was young folks who were most at risk. And knowing who's going to be more likely to either become infected or have a harder time fighting the infection helps us make choices about what our thresholds are for risk. Will I not go out at all, or will I go out with a mask and social distancing, or am I not worried at all? Please don't go that route. But that kind of evidence-based policy is reliant on information. And so we have some expectations about our information being used to create that kind of policy and to create appropriate guidance and to create treatment to help us improve our chances of not being infected, surviving an infection, and building up herd immunity and finding a vaccine and things like that. So that's one of the public health expectations as well. And then finally, we want to know, right? I think everybody's more comfortable when there's information being transmitted out to you. So we want to see reporting and communications. We want to see if this infection's in our community. We want to know if the guidance that's been put out so far is working. Are we seeing trends like flattening of the curve? Are we seeing changes in who is and isn't being infected? We want to know if we're still on an upward hill or battle, or if things are calming down. And so there's an expectation by the public to see what kind of numbers are still happening out there. Again, to help us make decisions in our life, but also to give us a sense of control or a sense of what our risk is. So those are the three big areas in terms of public health. Another one that I could talk about that I don't have a ton of information on is just telehealth and being able to continue to see your provider. Now, everyone's kind of done this a little differently over the last couple of months, which is why I didn't want to get too deeply into the specifics. But we are seeing all sorts of online or over the phone health, like meetings with physicians, appointments, renewals of prescriptions, those kinds of things. And that is another, I think, expectation by the public, even if it's not about public health, which is the health of the entire community. And so people do want to know how they can safely still get health care without needing to be there in person. And so that's another expectation that people would have. And I can talk a little bit more about how that's possible, but it's very dependent on the provider. Some providers actually have you come in person in a sanitized space that's sanitized in between uses, and that way they can provide you with the equipment that you might need. They're doing this in the downtown east side where folks may not have access to a computer or internet, and so they can come in and their doctor's in a different room. and there's a computer there for them to use, and they have their virtual visit in the same building. That's pretty rare. A lot of people are just using the phone, or they're using video conferencing like this GoToMeeting or Zoom or other options. And we've seen health authorities ramp up and change their rules about what kind of visits can be managed via Zoom, for example, which is the free, like the most free or cheap version that folks are getting used to using. And we'll talk a bit more about Zoom in a bit. So those are in general, the public health expectations that that we'll see on one side of the teeter-totter of public health versus the personal privacy. Now we're going to get into the privacy risks during a pandemic, and I'm going to get more into detail here and talk through some of the specifics that I'm sure a lot of us have seen. And I'm going to start with testing. So there's all sorts of testing, and I don't know how many people here will have been tested, because there are some criteria still, although they've opened it up quite widely about who is allowed to be tested. When at first it was just, have you been out of the country or have you been in contact with a positive individual? Now they've opened it up to anybody who has reason to suspect that they've been in contact or has symptoms that may be similar to COVID is allowed to get testing. Kinds of tests that I'm going to be talking about when we're talking about risks. And so there's the blood tests, the rapid blood tests, but there's also testing like temperature testing, where I think you saw the photo on the first slide where you can do a quick temperature check via your forehead. And so obviously there's benefits to testing that we want to see what the numbers are and see who we're in contact with. And then of course there are going to be some concerns around testing and where the information would go. So in BC, all testing results end up with the BC CDC, that's the BC Centre for Disease Control. So anytime that there's a positive test, that information goes to them. Then the BC CDC will send a notice to you, either by the phone, typically with this one, or they'll have other modes of contact if they've already been in contact with you. They'll also be in contact with the public health office for the local health area that you live in. So that's where some of this testing information can go to. And the public health office may do some of the contact tracing that we're going to be talking about in a bit, or they may be the one that's communicating with you about your positive result. So those are two areas that your test goes to. Your test doesn't necessarily go to your clinician or your physician, and it doesn't necessarily go into any other large databases. However, when it goes to the BC CDC, it is available to any folks who need it in order to manage public health. So public health office, health authorities, the BC government Ministry of Health, all of these folks are going to have access to that database in order to manage the health risks around COVID. So that's some basics on testing. I want people to think of who testing benefits. So the other kind of testing that I haven't talked about yet is antibody testing. And antibody testing is really interesting because it's beneficial to two types of people. It's beneficial to yourself, because knowing if you've had COVID already may give you an understanding of what your health has been like and maybe why you were so sick in February or March. But it's also possible, we don't know yet, around whether or not having it once would make you immune, in the future, whether it's for a little while or for a long time. And we don't know yet much about that, but it would be helpful to know if immunity is being built up in our communities. So antibody testing is of benefit to you and, of course, to public health, as are the blood tests. They're very beneficial for you and public health to know if you have a positive test. Temperature tests, however, which are a kind of a screening method. So if you're going to go on a flight, or if you're going to cross a border, we might see people taking your temperature. They're taking temperatures at the theme parks they're reopening, and in workplaces they're talking about taking temperatures so that if you come through with a fever, you'd be asked to go home. And there's some arguments about how effective that can be, because obviously some people actually will present as having a high temperature just from being outside in the sun for a little while, or might not have a fever, although they have COVID. So it's not particularly effective. Plus, it's not hugely beneficial because it doesn't tell you that you are COVID-19 positive, and it doesn't tell you that you have been positive. It just tells you you can't get into the place you want to go today. So when you're trying to balance how invasive a test is with the benefits, you want to really think about who's benefiting. And in that case, I don't know actually who would benefit from a temperature test, because right now it's not been proven very effective. And again, you want to think about who's getting the testing information, like I talked about with the antibody test and the rapid blood tests. We talked about who's getting that. If you're doing them privately, let's say the antibody test isn't rolled out for a while and you're really curious and you really want to know if you've had it, and you want to make a decision about getting the antibody testing, I'd like you to consider who's doing the test and who would have that information, and whether or not you'd be comfortable with them having that information. One of the reasons to not be super comfortable about folks having your information, especially your personal health information, is in the private sector. So I'm personally a little less concerned with BC CDC or the ministry or a health authority having my information. I see what they do with that information, and I see the benefit, and I have a lot of respect for the research and the program and planning and evaluation that they do. When it comes to private companies, I have a lot more concerns. The data that they collect through private testing, whether it's things like antibody testing or maybe DNA testing, things like that, it's very valuable. It's high value in terms of financial benefits to that company, and selling it is something that they do all the time. And if it's sold and it's aggregated and it's used for something you can get behind, that's one thing if you know about it. However, if it's sold to an insurance company and it's not actually fully aggregated, and all of a sudden you're seeing your premiums go up, well, that would be a huge issue. And so a lot of people, when they have concerns around private testing, that's what they're looking at. They're looking at insurance, they're looking at law enforcement and whether or not it would be used appropriately. In Ontario, there's some talk about police or law enforcement being given the names of individuals who've tested positive with COVID, so they can know who they're coming into contact with and whether or not they're a risk to them. Now, it sounds great at first go. Of course, you don't want to put your police in danger. However, there's no way of knowing how old that positive test is. They just get a list of folks and whether or not they have been positive. And if they're not positive anymore, are they not going to get the care that they need from their law enforcement? Or are they going to be negatively affected in some other way from being on that list? And we've seen criminalization of other infectious diseases. And I highly doubt we'd see that with COVID, but it's always something that's on my mind. Ever since, Canada is one of the few countries that has criminalized HIV infection transmission. So it's something that, my mind always goes to. All right. So that's just the questions to think about. Are you comfortable with that company having your information? And with things like the temperature testing, one of the ways that they're talking about mitigating that risk is to not record that information. But to me, that doesn't ring very true. Say an airline is doing testing of your temperature before you get on the plane. The whole reason an airline would do that would be to show that they're doing their due diligence. We tested them before they got on the plane. It's not our fault that everybody on the plane got sick. And so they're protecting themselves against lawsuits, and they're protecting themselves against regulators coming back. And if they're not recording that information, there's no way of them proving that due diligence. So it's highly unlikely that they're not recording it somehow against their seat number or something that would actually still be able to identify you. So I question that, and I question whether or not this data will be shared, and it's something to think about. Again, like I said, much more concerned about corporations and their collection and sharing of this kind of information. I don't have anywhere near the same fears around the BC CDC or health authorities or public health offices collecting that kind of information. Yeah, so that's the biggest pieces about testing. I want to talk about, the scope. Why are they testing for so many things, or or so few things? Is it helpful? I want to talk about or think about, who is it who's collecting? How is it useful? Is it a new test? Is it super novel and untested? We're already seeing that one of the first tests that came out in the States is showing that it's, less than 50% accurate. That's the Abbott test. So how, is it a dependable test, and will they be sharing those results? And so one of the things I wanted to show you is the ways that privacy folks think about testing and health monitoring. And I'm not going to go through this whole slide, but it gives you a little bit of insight into our brains. So some of the things I was just telling you about what to consider and what to worry about, we put under a series of tests or principles in privacy. And those tests or principles are, is it appropriate? What's the context? Is it reasonable in this situation? Like in a theme park, is a temperature test really going to help you weed out folks who may have a fever and therefore have COVID? And then we look at some of the other ways to minimize risk. So use limitations is a big one, and you can sort of read some of the examples on the screen. But ensuring you're only going to use the data that you collect for the purpose that you told the person you collected that data from is a big key principle of privacy. I'm telling you, I'm taking this test data to give you an idea of whether or not you've had COVID in the past. If I don't say at that time, I'm also going to sell that information, then you haven't appropriately limited your use. And if you're going to use it for some other purpose that you didn't tell me about, that's not appropriate either. Data minimization at the bottom of the slide, ensuring you're only collecting as much data that you actually need to answer the question that you're trying to answer, and ensuring that you delete it when you don't need it anymore is another really important part. You only collect what you need, you only keep it for as long as you need to, and you only make it available to the folks that actually really need it in order to do their work. So I don't want BC CDC sending that positive result out everywhere. There's no reason for it to go in PharmaNet. But sending it to my public health office makes tons of sense, because they're the ones that are going to do on the groundwork with me to ensure that me and the community are protected. Okay, and then there's some security and transparency stuff. Security is really about, like, how are you protecting it? When you're storing it, are you just leaving it out for anyone to get it? Are you keeping it aggregated, or does it still have my name right with it? And is that appropriate too? And are you storing it with stuff that you access all the time, increasing risk, or are you storing it separately and only accessing it when you need to? Those are some of the questions that we ask. And then transparency is key. What do the data subjects know about who's collecting their data and why? So that's the you. Why, have you been told that this was going to happen, that you're going to collect this data, that it was going to be used this way, that it's going to be shared in this way? Do we have a way of finding out more? Is there somebody there who's been identified as the person to answer questions that folks might have? And so we ask all sorts of other questions, like what jurisdiction are we working in, because the laws are different all the way across Canada. Who's doing the testing? Is it private or for profit? Is it an employer? Like the why. Are there appropriate legal authorities in place to allow for it? And so these are some of the questions that have been coming out, and folks like me, folks at the Office of the Information and Privacy Commissioner, which is a sort of a watchdog in BC for privacy, and their colleagues across Canada, they've all been asking these questions of the tests, of the contact tracing methods, and the new applications. I'm going to talk about that in a minute. So there are people out there asking these questions. How long are you going to keep this data? Are you being transparent about it? Are you keeping it secure? All right. So now I'm going to talk a little bit about surveillance and contact tracing. So surveillance, I know when we mention surveillance, people think of like cameras, in the streets, the CCTV cameras and stuff like that. There's sort of two meanings to surveillance, and I want to talk about both of them today. So we've seen some pretty drastic surveillance in other jurisdictions. We've seen drones with loudspeakers yelling at people to go home, or just monitoring. We've seen monitoring of CCTV cameras to see if people are meeting up where they shouldn't be and sending people home. That's happened in a few countries in in Southeast Asia and Asia, and we've also seen that in Italy. Oh, water delivery, thank you. And in Italy as well. And so we haven't seen that here. And that's been also partnered with no curfews and no stay-at-home order. We've been asked to stay home and limit how much we go out, but we haven't had a stay-at-home order the way that maybe California did, and other jurisdictions in the States. And I know that Bonnie Henry's been working really hard to empower British Columbians to make choices to protect the health and safety of themselves, but the people around them, so that we don't get to the point where we have that kind of surveillance in place. The other kind of surveillance that happens in healthcare is actually data surveillance, and it's really important, and it is happening, and that is looking at the numbers every day to make decisions about what steps we have to take. So folks at BC CDC and folks at the BC Centre for Excellence in HIV and AIDS, and folks at all sorts of equivalent organizations across Canada are looking at the data about the tests, not whether they're positive or negative, but how the tests are working. They're surveilling that to ensure that they're reliable and effective. They're looking at they're surveilling the data around folks getting infected and making decisions about where we need to do more outreach or get more protective equipment in place, things like that. So changing staffing and whether people all arrive at the same time at the beginning of the day or they spread out, so that they can find out where the hot spots are. So clusters of infections, like we saw outbreaks in long-term care facilities, places like that. So that's a surveillance that I personally can get behind, because we're looking at data and it's almost always de-identified, rather than looking at people's faces via cameras or being invasive in terms of having drones in the street and that kind of thing. Another interesting thing about surveillance is what we're posting publicly. So folks publishing selfies and the like on Facebook publicly, maybe not just within their friend group, but even there to a degree. If you're taking a photo of yourself with a group of people who don't live in your home, in a space that you're not supposed to be in, what's going to happen with that photo if you put it online? Now, you have to have a lot of trust in the people that you're sharing with. Let's say you did have a stay-at-home order, like let's say we're in California and you're posting photos of yourself violating that order. Those are surveillance issues in terms of someone else being able to share that photo, maybe with somebody in enforcement who would follow up. Now, we're not seeing that in BC because we don't have a mandatory stay-at-home order. But I do want people to think about what they're sharing, and I want them to think about it in a privacy protective way. Am I sharing photos of myself doing something that shows a lack of concern around COVID, that shows a lack of respect? And how would that make me look? But I also want people to think about the words that Lori reminded us of earlier, the be calm, be kind, be safe, and the words that we're sharing publicly about our feelings around this pandemic. So a lot of us have had very anxious thoughts and concerns around mask wearing and being close to others and not having enough space in the stores and visitors coming to the island. And when we share that information publicly on public Facebook groups or the like, that's something you need to think about in terms of your privacy. And I don't know what kind of work Facebook is doing with posts around COVID and what kind of surveillance they're doing of the data that comes out of what you post. But I don't trust Facebook, and I don't trust its colleagues really in the social media empire in terms of how they're aggregating and analyzing that kind of information. So that's another more paranoid version of surveillance out in the world. Okay, so now I want to talk about contact tracing, which I think is a really interesting area of public health, and it really, really gets down to the crux of public health and private interests and your personal right to privacy. So first of all, I just wanted to give you just a quick, very high-level understanding of how contact tracing is done. So if you have an individual who tests positive for COVID, that positive test is sent to the public health office for that individual based on their address. So BC CDC would receive that positive test result. They would call your public health office, and they would actually probably fax some information because they still use faxes a lot. And the nurses at the public health office then contact the positive individual, the patient. They question them about the travel they've been doing. They ask them about who they've come into contact with, where they've been in terms of, were you sitting in a waiting room anywhere, were you in cars with people? They try to get an understanding of who you've been in contact with and for how long and in what circumstances. Because the more we learn about this particular virus, the more we know about where the big risks are. Are you in an enclosed space close together? Were you wearing masks or not wearing masks? What's the likelihood of transmission there? And once they figured that out, and they have this long list of folks that you've seen in the last 2 weeks, they then contact all those people. And they don't contact them and say, hey, Caitlin's got a positive test and you've been around her. They just say, hi, you've been in contact with a positive individual. And they know the date, but they're not going to tell you the date because I'll probably tell you who it was. And they're going to say, I need to know everybody you've seen from 14 days before that to 14 days after, or maybe they'll move the window around to kind of keep it private. But the idea is to be able to notify people and continue the tracing work without disclosing information about the individual with the positive test. And so it's a fairly privacy protective process that's been vetted over years and years and years by folks who are experts in privacy. It's a place where there's definitely a huge privacy risk because it is possible to find out who it is. But it is so helpful in reducing continued transmission that even if the teeter-totter is like this, it's still worth it. So we call this the privacy bargain. What are we going to get out of this disclosure of personal information, and what are the risks? And then we try to weigh them and make a decision. And although there are a lot of risks in contact tracing, especially when you're looking at sexually transmitted infections, which is where a lot of these folks have their training from, the benefits outweigh that risk. And we get back to that public expectation in terms of reducing transmission. Oh, I see. I've got a question. Go ahead.
A quick question here. I think for some people hearing about contact tracing, they might think it's a new program or a COVID-specific response. Some of us who come from HIV/AIDS know it's a really old a model. So could you just maybe speak about some of the other applications for contact tracing?
Yeah, well, contact tracing, like you said, came out of sexually transmitted infections. And so it's been done for decades, like decades and decades. And in fact, it started from, it started less particular to the individual, and they started it geographically. So when they looked at how typhus and some of the other infectious diseases were traveling around water and sewers, they started tracing it geographically and then contacting individuals that lived near that outbreak geographically. And then they applied that theory to contact tracing person to person. And so they've been doing that with not just sexually transmitted infections, but all highly contagious infections across all over the globe for decades, like I said. So it's not new to COVID. And it's not only for, some of the more stigmatized illnesses. It's really about how infectious and contagious a virus or a bacteria are. So if there's any more, then just type out more questions and we'll go from there. So where it's done. So contact tracing right now is done through the BC CDC. That's our regular method. In terms of the states, I know that there's some corporate contact tracing happening. So they'll work with like a university. Okay, we've had an outbreak at a university, and they'll have an individual who works within the university contact individuals to manage the tracing themselves. We don't see that as much here in Canada. I am curious to see what expectations will be of employers in return to work. And whether or not employers will have to do any more than they already do in terms of working with a public health office. So right now, if there's an outbreak of an individual who is working somewhere in person, the public health office is going to work with the employer and find out who else is there, who's on the floor, where does the venting push air, where are there boundaries and walls, and look at what transmission risks are for that location. But they're also going to say, I need to see who's there that day. And I'm curious to see how much more of that kind of contact tracing there's going to be moving forward. And I think that we will see that amp up a little bit. The other kind of contact tracing that's been bandied about by Dr. Henry that I'm less comfortable with are the idea that she wants restaurants and hotels and the like to keep records of who has been at their establishment on any given night, so that if an individual tests positive and they can check against those records at the restaurant. So I mean, there's a benefit. Yeah, I went to Babes, and they can go to Babes and say, okay, who else was here that night, so we can make sure if anyone else was here, we can get them tested, and that is a benefit. But I also, I mean, Babes is fine. I'd be fine with Lisa having that information about me, because I know that if I wanted to, I could go and talk to Lisa and say, after 6 months, this is not valuable information. We can talk about that being deleted. I don't know that I trust Earls or whatever to store that information in a safe way. And the reason I worry about that is not that somebody knows where I've gone for dinner. Like, it's not a huge risk to me, but I can imagine for folks that are maybe dealing with stalkers or abusive exes and the like, having that kind of information around, it just makes people really nervous. And I wonder if there's enough of a benefit there. And the only way we'll know is to keep learning about what transmission rates are like in those settings, and applying the risk of that to the benefit. And then we can say, look, there is a huge risk in restaurants. And I'm assuming that's why Dr. Henry has been floating this idea. But there are other ways to reduce risks in restaurants. There's the plexi dividers that you can put down, that there's, having some folks eat outside and having even less folks inside. There's redirecting your HVAC, the air conditioning that blows droplets around. There's all sorts of things that we can do, and that's one of the jobs of privacy folks, is to say, this one's invasive. Is there something you can do to reduce risk so this one's not necessary? And I know there is some blowback on the idea of the contact tracing at hotels and restaurants, if only because they're not trained on how to store that kind of information and who to make it available to appropriately. And so maybe there's a way to do that, but that would be a huge job. Also, contact tracing only works if there's fast, effective, and widely available testing. In BC, we're doing great. We weren't maybe as available as we could have been right at the beginning, but we got a test out that was reliable, and we did it earlier than many places in the world. So it's effective as well. And then we've widened it. Like I said, the parameters have been widened to allow for broader testing. And so that means that contact tracing is going to work better here. And so when we're balancing that risk versus benefit, I have more comfort in contact tracing here than I would in the States, where some of the testing is showing it's quite unreliable, that it's not broad enough. I mean, if you're in Arizona, you still can only get a test if you've been in contact with a positive individual, but you can only get that test to be the positive individual if you've been to Wuhan, like pretty much. So there are places where the testing is so unreliable that contact tracing is going to be too unreliable, and therefore doesn't meet that balance that I keep talking about. Also, contact tracing is best used when it's part of an evidence-informed policy and it's managed by trusted agencies. So when I was talking about my discomfort with restaurants, are they a trusted agency to me? Not as much as the BC CDC is. And then you're probably wondering about the COVID specific contact tracing apps, and that's going to be the whole next slide. So we're going to get to that. And so the risks, like I talked about, are to the person, harm and humiliation, possibly the insurance issues or law enforcement issues that I brought up. Risks to society around contact tracing and surveillance are also quite big. we've got concerns around voter suppression because of not being able to do mail-in voting, that kind of thing. If you can't go out, if we can't get surveillance and tracing and testing to allow us outside, then we're looking at issues around how we manage our democracy. And the other piece of that, of course, is the placing of economics over our healthcare systems, valuing economics more. So those are the societal impacts that are not necessarily as privacy specific, but are things that we have to take into account. Okay, I'm going to talk to you a little bit about the apps that are being made. So I'm just going to introduce the idea of contact tracing apps or contact tracking apps from scratch, just in case nobody here has heard about them or anyone here hasn't heard about them. The idea is that contact tracing is a huge job, and it's quickly overwhelming public health offices. And it's privacy invasive, which we've talked about a bit. Now we've talked also about how much of a balance there is there, but if we can improve it, why wouldn't we? And so we've had a lot of folks saying, what about using the tools that we all have in our pockets, our phones, to help us with contact tracing? There's two ways to do that. One is to understand where people have been, so GPS and location tracking, and the other is to understand how close you've been to another person. And that would be using Bluetooth technology on your phone to see if your Bluetooth got close to somebody else's Bluetooth. So the idea is if you were to become positive, you have a positive test result, you enter into the app that you're positive, and it will then go and it'll look at anyone that was in the geographic area, the GPS area, or anyone that the Bluetooth has come in contact with because you were close enough, and tell them, you have been in contact with a positive individual, you need to go tested, you need to quarantine. And so that would help people with reducing the transmission risks. If you get this notification, now's not the time to go to a crowded restaurant, now's the time to go get a test and go home and self-isolate until I know more about my status. Everyone's been trying to rush out these apps because of course they sound great. And of course, there's been a whole bunch, some of them coming from private organizations, some of them coming from public, and my apologies. And the problem is that you can balance the ideas like we've been talking about, but until we can actually look at the technology of how you're managing it, privacy experts can't say that this is going to be a better balance than the typical contact tracing. So with this particular one, this Alberta app, there's nothing in it that says how long the app's going to be around, so that how long the information it collects will be used, or where and by whom, except for that it allows it to be used for research anywhere. This particular app needed access to the device's location data, but it doesn't collect location data itself. So why would you be in order to use the phone's location data, you have to consent to it. But if the app isn't needing it, then you shouldn't be forced to consent to it to use the app, because like I said before, you don't want to collect data that you don't need. And as soon as you allow the app to collect location data, it can. And therefore, if it doesn't need to, that shouldn't exist, that connection there. The consent for this one in particular was very broadly worded. Of the 53 contact tracing apps that have been made available globally, 53 in 2 months, which I think is just amazing, 25% of them don't have any privacy policy whatsoever. 57% of them use GPS and instead of Bluetooth. And the GPS issue for privacy experts is that tracks you on a map. That tells people where you've been. And that's much more privacy invasive than an anonymous Bluetooth handshake that could happen anywhere, walking down the street or at anywhere of the places that you go. And it doesn't, a Bluetooth handshake doesn't say this handshake happened right here in this place. It just says it happened. GPS puts you on a map, which of course is a privacy issue. That, however, doesn't mean that Bluetooth is great. Where you have dense areas like New York or Milan or Wuhan, or even if you were to get into some of the other big cities in the States, you just need to be 2 meters from somebody for that handshake to happen. So I could be in this tiny little shed that I'm hiding in right now, and the person in the shed would um, have a positive handshake with me. But I could also have someone behind this wall with their phone right there, and it would say that we've come in contact. If they were to just walk by, or if they were sitting on the other side of the wall having lunch in a totally different restaurant, it would say that we've come into contact. And the problem with false positives like that is that you stop trusting the data. And if you're not trusting the data, you shouldn't be collecting it because you can't use it. And if you can't use it, don't take it. That's a privacy risk. So the other issue is that people can sabotage this. They can say they're positive when they're not. There's no controls over that. And again, false positives and false exposure and notifications cause panic, and you no longer have trust in the application. And the other issue that people worry about with these, especially with the corporate private sector apps that have been created that are super decentralized, they're not managed by a health authority or a provincial government or that kind of thing, is that you have to worry about what's the benefit to them for creating this app. If it's a free app and it takes a lot of work, what are they getting out of it? Probably ad tech, probably location tracking, something that's useful to them for some other reason that's not privacy protective. And so again, we go back to that. Can you trust this? Is this what we want? So we have those concerns, but we also get a false sense of security when we use applications that we haven't tested very well. We say, well, I've got this thing. It's going to tell me if I've come into contact with somebody who's COVID positive. So now I don't have to worry so much about self-isolating if I'm, I saw someone cough and they were close to me, but I didn't get a notification, so it's probably fine, and I can go see my grandmother in the care home. We don't want to see that kind of thing happening. So the other worries I have around the contact tracing and tracking apps are consent and trust. Are they being properly consented? How many people read those long terms of use and then click I agree? Not many. It's a big job, and not many people understand them. And so you need to be able to consent properly, which means it needs to be somebody who cares, who writes that consent, who advertises about it. So again, to me, coming from a government is going to feel a little better because hopefully they're doing a lot of communications in the public sphere that'll explain it. It needs to be voluntary. You need to build up public trust. If you force people to use a tracking app that locates them on a map, you're going to lose the public trust, and then you're going to stop getting accurate data because people are going to find ways of blocking that on their phone. They're not going to trust it. And with something like this, you need everybody to use it in order for it to work. Everybody's got to have that handshake technology turned on, or the appropriate approvals and privileges on their phones turned on to allow that handshake to happen. So we, again, have a whole series of experts who are asking questions. And in fact, in Canada, there are now papers and series of questions that have been provided to government federally and provincially to help make better decisions than maybe were made around the Alberta version, that ask about whether it's necessary, whether it's proportional, is it effective, have we found a way for it to be minimally intrusive, Bluetooth over GPS, is it effective, Bluetooth over GPS again, and we have those questions to ask. Will it de-identify properly, as in taking your identifying information like your name off of the rest of the information? And what safeguards are in place to protect your data once it's being stored? So those are all my big concerns about the contact tracing app. All right, lots of talking. I'm just going to take a sip of water for a second. Okay, other kinds of data collection and surveys. Sorry if that was a really low. So I'm sure everyone's seen a lot of data collection and surveys happening. And one of the things I'm curious about is how much people haven't seen that's still happening. So we've seen some surveys. We saw a survey that's come out from the BC CDC. And they're again asking about whether or not people have had this already. Did you have symptoms in January and February? And they're asking a little bit about if you have any sort of respiratory illnesses, cardiac disease, those kinds of things. So they're trying to get a picture of what kind of herd immunity may have built up already, but also how many vulnerable folks do we have out there right now in terms of the comorbidities that they're seeing are dangerous with COVID, like heart health and respiratory health, immune suppression, those kinds of things. So there's the BC CDC, all the CDCs, all the Centers for Disease Control across Canada and also in the States are running surveys and collecting data right now, which is, I think, appropriate for managing healthcare systems. There's also data collection happening from accredited research ethic board approved academic and health authority researchers. So they're also looking at how people are faring during treatment, testing rates, all sorts of stuff. Surveillance. They're looking at the data and they're asking questions of it to help improve our response to the pandemic. There's a risk to that kind of data collection. Obviously, some of it's very personal around your health and your health care and around substance use disorders and other criminalized behaviors. And so again, when people are doing these kinds of collection, I want you to consider who's asking and think, what's my risk here? If it's the CDC asking, if it's your doctor asking, if it's a health authority or the Ministry of Health, their interest is in response and improving the healthcare system. If it's like an unrecognizable organization or agency or corporation asking, what's their benefit? And I'm going to get a little bit more into that. There's these online aggregators that I want to talk about a bit. Here's an example. This is ncove2019.live. This is a website that was built by a teenager in Washington. He started this website in December when he started hearing about the news out of Wuhan and started what's called scraping data from public websites around the world. So the Centers for Disease Controls around the world, and health authorities and other health offices that publish information about how many positive tests there are, how many folks are in critical care, how many folks have deceased, and then tracking the changes. And he just scrapes the internet every 10 minutes or so and updates this aggregator website so that you can see, and this is, I think, from yesterday, where we're at. And it's a way of reporting out, like I'm going to talk about in a bit. But in order to do this, he's collecting this data that's public, and that gives us some information. But it also, at this level, aggregate level, I have no concerns. But when people start trying to back that up with like surveys, so here's one that he did that's a survey, and this one doesn't terrify me, but I don't love it because I don't know that I want folks who aren't bound by privacy law to be asking me privacy sensitive questions. So if the CDC asks me questions, they're bound by the Freedom of Information and the Privacy Protection Act of BC. They're regulated by the Office of the Information and Privacy Commissioner, and I have a level of trust that they're going to do their best to protect that data. Now, this particular survey is not awful. Like I said, he rolls it into age groups instead of asking, what year you were born. I can't stand that it's a binary sex question. And then, your list of conditions, those are conditions, and this is to tell you how well you do, by the way. Like people really want to know, how am I going to fare if I get COVID? And so far, these are some of the indicators that you wouldn't fare as well as if you have cardiovascular disease or diabetes or respiratory diseases. COPD would be another, hypertension, cancers, those kinds of things. And so there's an algorithm behind this that would say, hey, you need to be more careful, or hey, you're young and you don't have any of these conditions, and maybe you're going to be a bit more likely to survive. And so that's a carrot for people. They want to know how they're going to do. And so these aren't particularly invasive questions, but if there was a collection of my IP address, through my provider, I have my own address that's specific to me where I live at this house. If he was collecting this and it was linked to this, and he chose to sell it to insurance, and I hadn't told my insurer that I had diabetes because they were going to charge me $500 a month, well, that would be a problem. right? Because you're going to see your premium change. So that's where I start to care, is when I see things like this. There was one really bad one I saw that was a website questionnaire. It was run by a software company out of the UK that was building probably a fantastic tool for folks to use, that asked a huge amount of questions, including your postal code, including your longitude and latitude, so that they could get a really good map of where the disease was and where the most vulnerable folks were, so that, you know, care can be given to those areas, which seems appropriate. But it was the software company doing that. There was no protection on the data. In fact, that just created a massive open source, publicly available data set. And I was able to get it down to somebody in the Gulf Islands answered it. And I could tell that it was either Maine or Pender. And I could tell a whole bunch of information about that individual. Not this individual particularly, but in the questionnaire were questions about your substance use. And so that may or may not have an effect on how well you'd fare if you had COVID, but it sure does have an effect on law enforcement and insurance if you're answering honestly about different substances that you use. So these are the things that I'd like people to look out for, are these questionnaires and surveys online. One of the places that people get information that are researchers, that are appropriate folks to be doing this kind of work, are through the census. So if the government runs any more, they've already run 2, I think, different census surveys already on COVID and mental health and some other ones. That's another place where a survey can be taken that may be more privacy protective, where you know the data is going to go to researchers who are improving local health systems. So that's a survey that I would be more supportive of. Researchers are also using administrative data sets. So when you are admitted to the hospital, or if you get a ride in an ambulance, or if your doctor bills under a certain code, or let's say you were to die, that data gets put in these administrative data sets through the Ministry of Health. And that's very valuable, especially because we know that we don't have good testing data from the very beginning. It'll allow us to say, okay, look, we saw sky high mortality rates for cardiac arrest and pulmonary embolisms in March and April and May. For folks without a positive COVID test, so you could take those and you could look at that and you could say how many of those folks were admitted to hospital, and then you can look at that data and you can start to make a picture of who maybe had COVID, who didn't have a positive test, and we'll get more accurate understanding of just how many people have been infected with the virus. And so use of that kind of data can be privacy protective. It can take your identifiers off. It can be stored safely. It could be limited to just those few questions that you've outlined. It could have somebody available to talk about why you're accessing it and what you're doing. They could limit it, how many people can actually use it, to just the researchers who need it in order to answer these important questions. Those uses are much more privacy protective and have a greater public health benefit than these online questionnaires and surveys like that. So if you're going to do a survey online, do the BC CDC survey, do the Health Canada or the census surveys. If you want to contribute your data, you don't have to, but if you want to contribute your data to help answer these healthcare questions, those are safer places to do it. Again, I'm just concerned about the criminalized behaviors, substance use being a big one, data that could affect your insurance, the trustworthiness of the collector, like I said, in terms of their ability to protect and secure that data, and thinking about what they value. The last thing I want to leave you with on this is the risk of not participating. If none of us do give our information out there, if we're not able to make these administrative data sets available to the appropriate people, then we're not going to get the information we need to improve the response to the pandemic and to improve our healthcare system. And so there, like I said, is an important balance there. Okay, and then I've got one more that I want to show you. This is one of the ones I really didn't like. I want to talk about a carrot. Okay, so this was a big tech company that put this out. They're called Enya, which really confused me. They ask you these questions. they put your answers on a map, and then they say, don't worry, we downsampled to about 1 kilometer to protect your privacy. But in a big city, 1 kilometer away is great. You know, there's hundreds of thousands of people within 1 kilometer in some big cities. But if you're here, 1 kilometer away could still be nobody else. So depending on where you live, downsampling by location isn't really going to help mask who's responding. What do they get out of this work? If it's a company like Enya, what's their benefit? I don't think it's as helpful to them as it is to a government or a healthcare system to get this information, except for to help them share something like their testing. And then a carrot. The carrot I want to talk about a bit. When you ask people to give your information, the only way to really truly get real consent is for there to be no carrot. There's no benefit to them other than the benefit to broader society, right? But if there's a specific carrot, like privately estimating your personal COVID-19 risk with their risk calculator, which is the same carrot on the previous slide, you really, really want to know what your risks are. You're very anxious. This is a carrot. And you're like, well, I don't really want to give them this information, but I really want to know what my risk is. I'm just going to do it. Or with the BC CDC, my only real complaint with the BC CDC survey is that they have a carrot as well. In order for you to get a free antibody test through the BC CDC, you have to give them more personal information, including like you have to tie it to you particularly, because then they can get a hold of you and they can put it about you instead of that being their aggregate big database that could be about anybody. And their survey did have a question around cannabis use. Cannabis use is legal here. It shouldn't affect much, but it will affect your insurance if somehow it were to get there. Now, I don't think the CDC would in any way ever share with your insurance, but it does present an additional risk. And they gave you the carrot of everybody wants that antibody test because it'll tell you if you've already had COVID, and everyone's really curious. And some people think that also maybe they're not going to be as much at risk if they've already had it. So consider the carrot, consider the source. Okay, hopefully I'm not rushing too much here. Reporting out. So this comes a little bit back to the public benefit that we all wanted about knowing more. So we want to know if it's in our community. We want to know if our curve is flattening. We want to know if the things we're doing are working. We have these expectations. But along with those expectations around reporting, there are risks. So it requires invasive collection of data in order to report out. And sometimes that's balanced and sometimes it's not. So we always have to continue that. Like I said, we want to know that if it's in our community, and we want to know what's happening with the trends. Reporting out is also, like contact tracing, really reliant on appropriate testing. Are we testing broadly enough? Are we testing fast enough? Are we testing early enough in the disease progression? All of these things help reporting be useful. And the reason I'm getting to whether or not it's useful is because don't collect data unless it's useful. Like I said, minimize your data collection. So the reporting out has to be useful in order for it to be worth bringing that kind of invasive collection of data in. One of the interesting things about reporting are clusters, like I was talking about outbreaks or clusters. And there's sort of two ways of looking at this. One is more of an outbreak. And so you'll see in communities or in long-term care facilities, et cetera, you'll see an outbreak and you'll have an idea that, look, you've got transmission happening here, either because you have staff coming and going a lot, or you don't have proper infection control protocols in place. Whatever it is, it tells you about transmission, it tells you about infection control, and it's useful. Another kind of reporting out is the cluster piece. And so this is where we get into some of the science and we look at COVID strains. So COVID-19 is called COVID-19 because it was 2019 that it was discovered, not because there are 19 strains, but there are multiple strains of COVID. They're already starting to see that the genetics of the virus are changing. And so as we learn more about, it's called phylogenetics, what that genetic tree looks like, you can see where it mutates and how often it mutates. And when you know about what strain you're looking at and where and how it's mutated, you can also use that for contact tracing. They do that with HIV as well. So they can say, this individual has this strain of the virus, and you can say, well, you are part of this cluster of folks because you all have the same version or the same strain of the virus. That tells me something about the geography, or that tells me something about how you interact with other people. With HIV, it could talk about your community of folks, and why that one community exists as a community because you're a cluster. It can tell you about travel. So I know this came from an individual who's traveling in China versus this came from community transfer, or this came from somebody traveling in Italy instead, where they're thinking it might be a different and maybe more deadly strain of the virus. And so seeing clusters and determining what behaviors led to them is helpful, because it can tell you how to reduce transmission, but it can also tell you a lot about the people. And with HIV, that can tell you about your sexual practices, or who you spend your time with. And with COVID, it can tell you about who you spend your time with and where you've been, but maybe also, are you are the people in that community, are they wearing their masks when they go to the store? Are they staying 6 feet apart? Are they doing what they've been asked to do to reduce the transmission risks? So that reporting out can tell you about a person and about the community that they're in. So that leads to risks, especially in remote communities where you have less folks. It's just easier to identify folks when there's just less people per geographic area. And so the other thing I just wanted to say again too on the reporting, it's less of a privacy thing, but it's personal interest. The best data that we're going to get is going to be in a while, right? Like when we have a chance to, like I said, look at some of the comorbidities. How many people have been dying of cardiac arrests? How many people have had blood clotting events like a pulmonary embolism and that kind of thing? And so we're going to get data from that. That's going to tell us more about how many folks are actually COVID deaths rather than other deaths. But again, just in all reporting, we've got to make sure that there isn't a risk of re-identification. So again, with the remote communities, I don't want to see reporting that's specific to a postal code. A postal code in Vancouver is only going to be so many folks among a lot of folks. But a postal code here, well, I mean, the full postal code's everybody on the island. But once we start thinking about connecting that to other data, we can start learning about who we're actually talking about. And it's easier to re-identify folks. I wanted to give you an example of some reporting. So this is the BC CDC, the Center for Disease Control. I included the link at the bottom if you want to check this out. This is not real time. It's almost impossible to do real time because you're so dependent on how data is reported. So for example, Sundays always dip. You'll see if you look at the graphs of how many people got sick or were tested positive. Sundays are a very healthy day, but also nobody's really reporting on Sundays. So Tuesday is really sick day because that's when everybody gets through all the numbers. So take things with a grain of salt. However, it is really helpful to get an idea of just how many folks in BC we're looking at. It goes down to the health authority level, so you can see how our health authority is faring. And yeah, just information about how we're doing with COVID in BC. BC is a leader. Just like we are a leader with HIV and other infectious disease, we have been a leader in COVID. I think we should be really proud of the work that the folks in the public health offices and the medical health officers are doing, and the BC CDC are doing fantastic work, and reporting out is a big part of that. And you'll see changes too in one of the Providence Healthcare, one of the providers in Vancouver Coastal. They'll actually show you how many folks per hospital. And they'll talk about the outbreaks in long-term care facilities, which I think is really helpful for folks to understand where the risks are. And so that's why reporting is great. That said, if you work for one of the long-term care facilities and it's reported out that there's an outbreak there and you want to go and pick up some food and you're wearing your scrubs and someone says you can't come in here, then there's a negative effect on you, or someone knows you personally and know that you work there and maybe shares information about you working there because they see you as a risk. That's some of the risks around reporting that we need to think about. And to me, the value of knowing the information and reporting is integral. And there, like I said, there's great value to it. And so we need to find how we can mitigate those risks. And some of those risks are mitigated with technology in terms of aggregating information. So maybe only looking at the health authority instead of down to local health areas or service delivery areas. Some of it is more like, what is our job as people in terms of being kind and being calm, and thinking about the fact that although we may not have a legal prohibition about sharing information about people, we have a moral duty to consider people's privacy and to consider what we're sharing about those people. So this goes to say that if you know of an individual on this island who is COVID positive, it's just because it may not be against the law for you to share that information doesn't mean that it would be right for you to share that information. So we do have an individual responsibility around what we learn via reporting, what we learn any other way, and whether or not it should be shared with others. Okay, almost through this piece. Just gonna switch quickly and make sure I don't have anything here. Nope, good. Sticking with me. We're almost there. Okay, bad actors. One of the things that I included in a lot of my guidance from the beginning of the pandemic was whenever you have a big, awful thing happen, whether it's a pandemic or an election that goes really weirdly, or a celebrity dies, or a really popular online tool is hacked or something, bad actors are going to take advantage of people's fears around that and ramp up their behaviors. So, for example, there's been a lot of malware in some of the online surveys and tools that are out there around COVID. Take this quiz, see how at risk you are. Just download this, and then you download it, and you've put malware on your computer that gives them access to things. Now, I'm not saying everyone needs to be terrified, but I want you to consider your source and what their benefit would be. And there's the privacy risk, but there's also the technology risk. If you don't recognize it, don't click on it. The same as always with malware and with phishing. If you get an email that says you've had a positive test, click here to learn more, and you've never taken a test, don't click there to learn more, because what you learn is not going to be great. It's going to be telling people about you instead. And so there's been a ramping up of those behaviors, partially from the regular hackers trying to get information about you. So you need to be on your guard. But there's also been like hacking of large governmental databases in the States by other countries and things like that. So there's all sorts of bad behavior happening out there, and I want people to consider those risks when they're making decisions about what to download and what to click on in an email. Also, if you are doing remote access for work, make sure you're working with your employer to use the best VPN available to you. I don't know how many folks are in this situation. I can't quite see who's here, but if you have questions around that, feel free to give me a shout after or include it in here. But if you're remote working and you're accessing your desktop at work, there's things you should know and do around that to protect your connection, the tunnel that you create between your computer at work and the computer that you're using at home. And I'm going to talk a little bit specifically around video conferencing in a minute, because we've all seen some news around Zoom, which is why we're on GoToMeeting today as well. So I'm going to go right into the next slide, if this will let me. Practical tools and actions to take away. So the key here is to know what works for you, right? So I've talked a lot about what I'm comfortable with and making decisions around what tools I'm going to use and what surveys I'm going to fill out and how I'm making those decisions. And that may work for you and it may not, right? Like you may go away and say, well, she might be fine with doing those BCCDC and survey census stuff, census survey stuff, but I'm not. And if you're not, that's fine. That's your boundary. And in order to understand your boundaries, you need to know what the risks are and what the benefits are. And so hopefully you've learned a little bit more about what the risks are today. And we talked a little bit about the benefits in terms of the public health expectations. You know, your boundaries are going to be different based on your situation, right? As a straight cis white woman, I don't have the same kind of risks that other folks might have. You know, and folks who maybe have a history with criminalized behaviors like substance use and that kind of thing may want to be more careful. And folks with stalkers might want to be more careful. And you know, folks coming out of an abusive relationship might want to be more careful. They always do in terms of how they interact with data collection. But I think because people are in a place of vulnerability and fear, sometimes we let our boundaries melt away a little bit more than we might. And I want you to consider that privacy bargain that I told you about, the risk benefit, the public health, personal privacy, both of those balancing acts that you need to do, and go from there. Check your sources. So who's asking for this information, and what benefit is it to them? Why are they asking for it? Knowing who's asking for information or doing testing or doing the contact tracing allows you to know if you can rely on them to follow the law. There's even a good law to protect you. There's good, strong laws in BC for privacy, some of the best, especially outside of Europe. And we can take some comfort in that, knowing that our public bodies like the BC CDC and the ministry are bound to some pretty strict rules. But other folks who maybe work in the private sector or maybe are outside of our jurisdiction may not be as easily enforced with them, and maybe the same laws don't apply to them. And so understanding the sources of like who's doing the testing or who's asking these questions, it's really important for making those decisions. But I also don't want fear to guide your choices. So I don't want you to be afraid of everybody asking questions. That's not my goal for today. It's just to ask you to think about it. But I also don't want you to be so afraid of this illness, this virus, that you're rushing to make decisions without considering these things. So it's really important to understand who's going to benefit from these interactions that you have. So just really, really briefly on video conferencing. I've given Lori a Zoom guidance PDF that I wrote for folks who are either participating in a Zoom call or who are starting up a Zoom call. Now, Zoom is a video conferencing software that allows folks to do what we're doing today, or you could have more interaction where you're able to all talk to me. And it's really helpful for online lessons or online health visits or meetings that you would normally have had in person. And there are a lot of options out there that exist already. So GoToMeeting, the one that we're using today, and WebEx, which is by Cisco. Those are two that I use all the time. Zoom I don't use personally because I don't have a lot of trust in them due to the way that they first rolled out their software. Now, sometimes you'll have an organization that rolls out software and then something goes wrong and everybody jumps on them because they rolled out the fastest, and that makes them fix it, and you get an even stronger tool. And sometimes that happens and it works really well. Sometimes it doesn't work that way, and Facebook is a good example of someone who gets in trouble all the time and doesn't really fix things. And Zoom's big problem in the beginning was that they actually built in a back door that allowed whoever they gave access to, so I'm assuming it was for law enforcement, the ability to look on your computer because you had the Zoom app on there. Now, you didn't agree to that, and that's not okay. And it's an egregious thing to do. It's not like, oh, geez, we forgot to make a waiting room so that you can control who comes in your meeting. I mean, that's just, you learn that by having someone Zoom bomb your meeting. It's that's just, to me, quite nasty. And so I don't have a lot of trust in them. So I've used GoToMeeting and I use WebEx, but sometimes I'm going to need to participate in a Zoom call. And so I built the guidance that I'm offering up based on creating a Zoom meeting yourself, if that's what you have to do. If you have to use it because it's free, I totally understand. It'll help you do it in a more secure way. But also, if you are going to participate in a Zoom call and you don't have a choice about it, it can tell you what kind of questions to ask. So you can say, can you please turn these settings off? I want to participate, but I need to know that you've done these things to protect my privacy. And the other thing about video conferencing is you don't always need it, right? So I've been working remotely for years, ever since we moved here, and nobody ever asked me to use Zoom or a video meeting. I had phone calls and I would just do it on the phone and it was no problem. And it was literally like the day after the stay-at-home order kind of went into effect and everyone's like, oh, I need to do a Zoom call with you. And no, you don't. It's the same thing we had done a phone call for before. And it goes back to that same idea of only collecting data you need. Do I need to see your face? Do you need to see my face? I'm giving you a talk today. It makes sense. It works. But you can always just say, no, I'd rather do this on the telephone. You're going to see less about an individual. There's less information being transferred if you're on a phone call. So feel empowered to say no if you need to right off the bat and just use the phone. And then feel empowered to ask questions about how they're setting up your video conferencing. And you can take the stuff that I've said about Zoom and apply it to any video conferencing app that you might be using. And the reason I'm talking so much about that today is I'm not sure, obviously, who all is here, but there are people who are doing Zoom calls with their grandkids. There's people who are doing Zoom for schooling, so their kids can interact with their teachers. There's people who are doing Zoom for telehealth, like remote health visits. So I just want you to feel like you have some control over this new way of interacting for a lot of folks. Yeah, video conferencing. So that's it. It's time for you to ask questions. I just talked for a really long time. I'm sorry. To seeing people for a second.
That was terrific. Thank you. So I have a question here, and this is a question that's come up in the community several times. Some jurisdictions are announcing community by community or region by region COVID stats, and some places like BC have gone to just those big macro regions. Can you speak a little bit about is privacy the reason we've not received that information about rates in specific communities because of BC's enhanced privacy legislation?
Yeah, that's a big part of it. So yes, the decision was made a long time ago in terms of reporting out on infectious diseases. Typically, the rule is cell size less than 5 would not be reported on. So cell size is like how many people. So if it's less than 5 people, you wouldn't report out. So that was a basic rule that's been used for a long time. And so that's a big issue in BC, but also Canada. So like one of the biggest differences between our reporting and reporting in Italy or the States is that we have 30 million people over huge geography. In the States, we have 300 million people over a bit smaller geography, and then you get to some countries that have 60 million and they're 1/6 the size of BC. So the UK is a good example of that. So a big part of that is just how much population do you have in a geographic area, and then a part of it is our privacy law, like you said, and then a part of it is also like how effective is it? How effective is it for you to know that somewhere in the Gulf Islands someone is sick? Versus how effective is it for you to know someone on Galiano is sick, and then how much of a privacy issue is it? And so then you make that balancing act as well. It's not particularly effective to know someone on all of the Gulf Islands is sick. You're probably still going to do all the same things. You're going to wear your mask. Please wear a mask when you go to the store. You're going to wear a mask. You're going to give people their distance. You're not going to talk longer than 10 minutes in a small space, unless you really, really have to, and you're wearing masks and you're washing faces and or washing hands and not touching your face, and you're doing all these things, right? If it's not going to change your behavior, if it's going to introduce a ton of risk, and if it's a different sort of technological in terms of geography and demographics, then the value is not there. So the value is just not there, especially in BC.
Thanks, Caitlin.
Yeah.
Your presentation was incredibly thorough and
Long.
provoking. Got another quick question about Zoom here. Clarification with respect to using Zoom. Is the concern that Zoom itself will harvest data from a computer, or that someone on the specific call will harvest data, or that a hacker will harvest data?
Okay. Well, so the one that I told you about with the backdoor, my concern was law enforcement inappropriately using that backdoor. That's been shut down. They dealt with that. There were enough complaints. They dealt with it really quickly. Then there were some issues around Zoom bombing, which was like people jumping in on meetings like this. You'd see the picture of some random person, and that was more just that it was invasive and kind of scary and weird. But some of the other tools in Zoom were about things like attention tracking, which I think is really awful. I don't need to know who here is actually just listening to my voice and Facebooking at the same time. Or maybe they're doing something else for work. Like I've been on teleconferences where I've been emailing people for work at the same time. And so I don't think it's appropriate for the presenter or the organizer to know how long I'm looking at the screen. So there's some features in Zoom that give data about the users to the organizer that I don't love. There's some file sharing stuff that wasn't great. So you need to turn that off so that you're not accidentally sharing or accessing files in a way that's inappropriate. And then especially with the Zoom bombing thing, if you don't use a waiting room and you use a public key instead of having private passwords, you have people attending this meeting and you're providing documentation, then you're looking at a possible disclosure of information that way. But I'm not so worried about the hackers.
Yeah, just a very quick story. There was a provincial AGM for a family organization that I'm connected to with 150 parents on there, and Zoom was the platform. And there was a deeply disturbing pornographic images being shared by a Zoom bomber, which exposed all of those families and really, really did some damage to the reputation of the organization with its faith.
Awful. Yeah.
So, there's real implications for nonprofits too, not just individuals, in terms of how we build trust in our communities with our users. If there's no, sorry, go ahead.
No, I was just going to say that sometimes these things intersect. Like oops, sorry about that. Sometimes it's that there's a real privacy issue, and sometimes it's a little bit privacy and a little bit just reputation and trust, right? And privacy builds trust. And that's like a key part. Yeah.
I'd like to thank everybody who attended today. Caitlin, I found that just so much food for thought. And so, folks, I've shared on the chat function, but for those of you on the phone, you can get in touch with me if you happen to have my personal email address. But the email address we're using to share these presentation tools for now is Galiano Library Meeting Tools @gmail.com, and we'll post that in the Facebook ad for the event, so folks who found us that way, you can always just get in touch with anybody from the library, and we'll make sure we'll get it back to you. But we want to do that on request and not bomb you with it, so ask me for it. And also the Zoom guidance document, which I just think is so generous of you to develop that and share with us, Kate, because many of us, like, even if we're not choosing Zoom, we're being forced to Zoom occasionally, even if it's to go to a birthday party, right? Thank you all. Stay well, be calm, be kind, be safe, and we will be building an evaluation that we'd like to make accessible to you all. So we'll get that out to you within a week as well. Thanks again, and have a great now sunny afternoon.